or false? Many employers are seeing mental health support for employees as an imperative. Is that true or false?
I think that's true, actually, both from the headlines I see and for business folks in the community and circle of friends and who reach out and say, this is what we're seeing. We're seeing more days missed because of mental health days, or we're seeing employees who before had been doing okay, but maybe are struggling with more episodes of panic. So I think that's true. That's certainly true.
Okay. Follow up on that. How can employers create a supportive environment that encourages people to prioritize their mental health?
Yes. I think one is, when we're talking about, or the language around kind of sick days, we all have a mental picture of a broken leg and a cough. And so sometimes it can be helpful to lead the conversation with examples that also include, mental health related things. I think, sometimes it's the subtle things that allow people to know, actually, it's okay to struggle in this way, right? So if someone says, well, or sometimes, when you're talking to your own kids, what's happening, what's going wrong. Sometimes they don't give you, the full breadth and height of what it is that they might be struggling with. And then sometimes you can give kind of categories of areas where they could be struggling. And sometimes that leads them in to be able to disclose a little bit more. So I think that's probably one of the easy kind of early steps to say, hey, this is a place where, you don't have to approach me to be your, therapist or to, help solve the problems that you're struggling with. But one, we're a community where it's okay to, to say, hey, I'm really having a hard time, and we're going to honor that and treat it in the same way we would, other kind of physical ailments that someone might be able to see. And I think, if there are kind of signs that let people know, here's someone that you can talk to without any mark on your record, without any, this affecting your, promotion or chance for ascending as well, that accessing the resources that, we might have or share with you it isn't going to be used in a punitive way, because I think that's part of the stigma, is that if people know that, I have ADHD and I get distracted sometimes, or if people know that I've had past episodes of depression, bouts, then they'll see me as unreliable, or they'll see me as less than, and that may affect my chances to ascend or to be as useful as I can to my organization.